All right, I'm Adam,
I'm Abby.
and we did our topic as intrinsic and extrinsic motivation and different applications compared to what we learned about in class.
Okay, so what is intrinsic motivation? We defined it as a natural urge to find challenges and experiences to further one's abilities and skills. It refers to doing activities or taking on challenges simply for the satisfaction you find in completing the activity itself. It stems from the different psychological needs we talked about in class, including autonomy, competence, and relatedness. Why intrinsic motivation? Intrinsic motivation has many benefits. It increases the persistence on different tasks. Creativity tends to be the highest when you're motivated by personal interest and enjoyment. It increases conceptual understanding and high quality learning rather than just learning material with like a test grade in mind. And it tends to promote optimal functioning and well being. This increases self actualization and self esteem. It promotes feelings of liveliness and vitality. It tends to lessen anxiety and depression and leads to overall healthier lifestyle choices when you're intrinsically motivated. So, what is extrinsic motivation? Extrinsic motivation is an external reason to participate in an activity, such as an environmental incentive or consequence. This is regulated by incentives, consequences, or rewards.
Okay, so let's look at some gender differences between extrinsic and intrinsic motivation, specifically when it relates to physical activity. Multiple studies have come to the conclusion that there are a lot of differences in motivation when it comes to gender. Each of the studies that we read found that males are much more intrinsically motivated when it comes to physical activity than females are. This may come as a surprise to a lot of people, as it might seem for the most part that both men and women are primarily extrinsically motivated because they just want to look better or they just like the results that come from it. The studies that we found that men are more motivated to exercise because of the benefits they receive, like health benefits, the overall enjoyment, so that's intrinsic motivation, and gains in strength, self-competition, and the challenge it gives them. And then men also like to challenge themselves to get better, thus creating this intrinsic motivation. On the other hand, this studies also found that women are more extrinsically motivated to exercise by factors like their physical appearance and weight management. Again, these come as a little bit of a surprise, as it might seem that there are other factors associated, which is true, and we'll address that later on.
So we read an article titled When Fit Leads to Fit and When Fit Leads to Fat, How Message Framing and Intrinsic versus Extrinsic Exercise Outcomes Interact in Promoting Physical Activity. This title is incredibly long, but basically what it's saying is that the article examined how the impact of gain versus lost frame messages change the type of motivation people have for physical activity. We have a couple examples on the next slide. Okay, so here is a table from the article, and first I'm going to explain the difference between gain framed and loss framed. So gain framed is basically the positive things that will happen. So say exercise now and feel better later versus the loss framed where it says did you forget to exercise? Forget being happy. So it's the positive effects and negative effects of exercising versus not exercising. And then if you look at the intrinsic versus the extrinsic, you can see intrinsic motivations are more or messages are more like exercise will improve your life versus exercise will improve how you appear, giving the intrinsic versus extrinsic gain framed message. The loss framed message for each, there's an example of forget to exercise, forget being happy, focusing on the intrinsic motivation, where the loss framed for the extrinsic outcome says forget to exercise, forget the bathing suit. Again, focusing on the extrinsic appearance of what happens when you exercise.
Okay, so when it comes to age and race, there are also differences in physical activity involving intrinsic and extrinsic motivation. So when you think about age, it makes sense that as you age, your physical activity is going to change. But with the articles we read, we found that there are differences in age. There's also a lot of differences in race, which kind of surprised me. So in regards to age, those under 20 are more motivated by health issues, while those over 20 are more motivated by affiliation with others when it comes to physical activity. which seems opposite to me because it makes more sense to me that younger people would be wanting to be more involved with others, while older people would be more worried about their health as it declines with age. We also read an article about German veterans that found that people under 25 years old and over 50 years old actually exercise the same amount, which is very interesting. When it comes to race, though, there were as many as 10 different factors that were significantly different between Caucasians and African Americans when it came to reasons for physical activity. So, Caucasians, it found that stress management, enjoyment, and weight management were the biggest motivations for exercise, showing that there was intrinsic motivation, at least as far as it goes with the enjoyment. But for African Americans, it found that health pressures and prevention and nimbleness were found to be their motivations, which was kind of interesting. And I didn't really understand it at first, but it makes sense that African Americans are actually had a higher risk for cardiovascular disease and things like that. So as they're growing up and going to the doctor, they're probably being told this more, which is going to make them more motivated to work out as far as health goes. Another application of intrinsic and extrinsic motivation we looked at was the motivations in physical therapy or occupational therapy. And we looked at this because I'm going into physical therapy and Abby's going to hopefully be going into occupational therapy. So when we looked at this in the general population, we found that compliance with a PT or an OT home exercise plan correlated strongly with age, education, and positive feedback. So it turns out that people are more inclined to work out if they're being told that they're doing a good job. So if they're getting the reward of being told that everything is doing well, then they're more likely to actually do the exercises. And in another study that we found that service members in Iraq and Afghanistan are they're more likely to do exercises if there are fewer exercises prescribed while they're on duty, and uh, this also has a lot to do with their time management. So it's very important for PTs and OTs to be able to explain that time management is very important while they're on duty, and so they can get their exercise plans done. So in essence, it's really difficult for PTs and OTs to be working in that situation because they want their patients to get better and do their exercises, but there's not a whole lot of time for them to do it. So just having fewer exercises is better for the PTs and OTs. Okay, so another article we read was about motivation for physical activity in veterans that had some sort of a leg amputation. So we found that veterans that have had part of their leg amputated have varying reasons for engaging in physical activity. Some being intrinsic, such as they're having a history of physical activity before amputation, so they enjoyed physical activity and had intrinsic motivation before amputation. So that means they're more likely to continue it after. Although amputation could also lessen their intrinsic motivation to be physically active because they may not find it enjoyable anymore. Also, veterans with amputations due to trauma are more likely to be physically active than those with an amputation due to metabolic diseases such as diabetes. And finally, it turns out that musculoskeletal disorders like spondylolisthesis have a tremendous impact on activity levels. And spondylolisthesis is a slippage of the disc between the vertebrae, so it causes a lot of pain, lower back pain for the most part. So this impact on activity levels may be because musculoskeletal disorders and spinal disorders are not able to be fully treated. They can only be maintained at their current level of disability. So if a disorder has gone too far, the patient may not feel that they should exercise because they don't feel like it's going to help. So there's no motivation to exercise at that point.
So which type of motivation works best? As we said, extrinsic motivation tends to come from outside the individual, while intrinsic motivation comes from within. The two are very different in regards to effectiveness, as extrinsic motivation won't necessarily create a long-lasting effect, while intrinsic motivation may do just that. Extrinsic motivation is primarily based on rewards, which can create an interest in an activity for someone, but when those rewards are taken away, what happens? At that point, if their motivation is changed to be more intrinsic, they may continue the activity, but if not, they might just drop it altogether as there's no more incentive to do it anymore. One isn't necessarily better than the other, they just create overall different performance effects. Okay, so you might be asking, can we only look at intrinsic and extrinsic motivators to get the full picture of people's behavior? Stephen Rice, in his article, says no. Theories that only look at intrinsic or extrinsic factors tend to be lacking in construct validity, measurement reliability, and experimental control. Rice suggests to look at validated, multifaceted theories for research. All in all, it's always important to remember that confounding factors and error in research, and to know that the individuals will always vary in their own compared to the population as a whole.